Bueno, pues estamos terminando ya la primera jornada. Se nos ha ido como el agua entre las manos, pero todavía tenemos hasta el viernes para estar con todos ustedes. Gracias. Me cuenta María Teresa Vergés, el seguimiento, las preguntas, la interacción que están haciendo con nuestro canal YouTube de OAFI. Saben que ahí tenemos el teléfono, ahí tenemos nuestra página web, que es un simposio que hacemos con todo el cariño, articulando el deporte, juntamente con el Comité Olímpico Español, juntamente con la Fundación del Club Atlético de Madrid. Hablando de deporte y hablando de tratamientos, hablando de terapias para los deportistas, la condroprotección, eso que tanto sabe nuestro presidente, el doctor Josep Vergés, que además va a cerrar esta primera jornada abriendo fronteras, porque este simposio también queremos que sea internacional. Doctor Vergés, tenemos una auténtica autoridad que nos escucha y nos ve desde Bélgica.
Exactamente. Ricardo, como dices muy bien, bueno, está todo el Congreso transcurriendo de forma fantástica y una de las áreas que es fundamental es la terapéutica. En el Congreso podemos decir que de las 20 mesas pues probablemente hay un 30% o más terapéuticas, de nuevos tratamientos en el área de las condropatías, tanto en el deportista como en la artrosis, ¿no? Entonces, es muy importante. Y hoy contamos con un gran especialista, que es el doctor Matthias Schiffers, que es un gran experto en el tema de las condropatías y el tema de la artrosis, y nos va a presentar, dijéramos, el título, ahora lo pasaremos al inglés, el título es Una nueva área en el tratamiento de la artrosis mediante derivados de Chitosan. Nos lo va a explicar muy bien. Es una compañía Chiomet especializada en todo el tema de la artrosis, entonces, bueno, es un gran honor pues, que vengan aquí a presentarnos un nuevo tratamiento para la artrosis, ¿no? Entonces yo lo que voy a hacer es pasar al inglés, si me permites. Y, well, first of all, I would like to thank to Dr. Matthias Schiffers, to stay with us in our first symposium we are doing during this week in Spain, that we are organizing with the Spanish Olympic Committee and the Fundación Atlético de Madrid. We are very happy to do it. And you are a good expert in this field. You are the medical director of Pharma Chiomet, that is a company specialized in this field in Belgium, France, and other territories. The title of your presentation is New Area in the Treatment of Osteoarthritis, a Derivative of Chitosan. Thank you to be with us, and when you want, you can start it.
Thank you very much, Dr. Vergés, for this nice introduction. And obviously, osteoarthritis patients suffering from knee arthritis, there are too many present nowadays, and that's why it is very important in a disease area which is growing from an incidence standpoint, but also a prevalence standpoint, that new therapies are being provided to the market, just to be able that we as physicians and medical doctors are able to come with personalized treatment scheme just to reduce symptoms. As you've alluded in your introduction, I'm today representing Chiomet Pharma, being the Chief Medical Officer, and I want to give a talk about the recent evidence we've got regarding a Chitosan derivative, which is Coumadin versus 1. So Coumadin versus 1, a Chitosan derivative, is a new generation of single-shot injection, which is intended to treat symptoms from patients suffering from symptomatic knee osteoarthritis. It is one of the world's first exclusive animal-free Coumadin based on a carboxymethyl Chitosan formulation. As I said as part of the introduction, we are not an HA, and we are not native Chitosan, but we have been working on a unique chemical structure to be considered to be a soft implant. And in fact, we are an intraarticular injection for treating those symptoms. The way it's presented, and further to my talk, I'm going to introduce you to the clinical evidence, but also talk about patient, talk about the clinical evidence we got so far. And I got the opportunity later on to share some real-life experience we have from patients being treated with Coumadin versus 1. It is presented, as you can see here on the slide, in a pre-filled syringe. It's a 3 ml glass syringe for patients suffering from osteoarthritis, symptomatic one. It's a single shot injection, which you have to inject with needles going from 20 to 23rd G. Why developing Chitosan, or why developing a unique carboxymethyl structure of Chitosan? There's generally a need to work on better enhancement of lubrication and mobility of patients suffering from osteoarthritis. And thanks to our clinical research and preclinical research we've been performing at QIAMED, we've been able to demonstrate in preclinical setting a higher lubricating capacity of Coumadin versus 1 versus to other single shot injections, which we'll see later on has an impact on symptoms. We also have been able to demonstrate an improvement of lubricating properties of the synovial fluid. All this together, better lubrication, will also means later on better mobility. This statistically significant we've been able to demonstrate in the preclinical setting, but in a few couple of minutes, I'll show the data on patient and on our clinical trial called APPROVE. Enhancement of lubrications, very important. Enhancement of mobility, very important when you're suffering from osteoarthritis, but also the protection of the synovial fluid. We all know that osteoarthritis is a degenerative progressive disease where oxidative stress is present. And being able to demonstrate, as you can see here in this model, on a higher scavenging capacity versus other compounds, statistically significant, this is the way we're going to explain the mode of action, and this is the way how we explain the reduction of pain when it comes to patients. Second to that, one would argue if you do decrease the oxidative stress into the joint because of the disease, osteoarthritis, one would suggest that we do protect the synovial component. And that's on the right side of the screen what we've been able to demonstrate. Coumadin versus 1 strongly contribute to the protection of endogenous synovial components from oxidative stress by capturing free radicals. And that's quite unique mode of action. That's the way we explain how our medical device class 3 is reducing symptoms. You all know better than me that osteoarthritis, as I said, is a degenerative progressive disease of the joint space. Reactive oxidative spaces in the articular environment is dramatically increasing, hence a reduction of synovial fluid, hence diminishment of lubrication of the osteoarthritis patients, and pain is appearing. Pain is one of the most harmful symptoms that osteoarthritis patients are confronted by. They're suffering from pain, they're stiff, and they're not functioning. Hence, with our medical device and with a single shot injection into the knee, we're rebalancing the synovial fluid by protecting the synovial component, but also by lubricating them. As I said, in the thorough preclinical development program we've been systematically being able to demonstrate this significantly versus other products that are being used. Question to that is, from a mode of action standpoint, as I alluded towards, dual mode of actions. The question is then, is the protection helping patients from symptom standpoint? Is the enhancement of lubrication helping our patients? And how long the soft implants does stay within the joint? I can tell you from a degradation resistance standpoint, it stays within the joint up to 1 month, but we do have a lasting effect on symptoms up to 6 months and beyond. And you will see this when it comes to the clinical trial setting and to APPROVE clinical study. So let me run you through the APPROVE clinical study. Hence the point that QIAMED, scientific-based biotech company, strongly develop the proof of concept on a preclinical way, but also reached a clinical setting with this clinical study, which is called the APPROVE clinical study. It is our pivotal international multicentric study. It is our first-in-man study, which enabled us to get the product registered. It is a first-in-man, it's randomized, it's single-blinded at patient level, and I'll tell you later on why this is important. And a little bit more than 100 patients have been injected with Coumadin versus 1. The patients who were included into the clinical trial were symptomatic patients suffering from knee osteoarthritis. Very much important so, A study was performed in 2 European countries, Hungary and the Netherlands, with Dr. Skadic and Haverkamp being the national coordinator. And all the data that was developed during the clinical trial were independently reviewed, either by the CRO and by an independent data monitoring committee with clinical experts. So we talk about patients, we talk about an innovation, we talk about new treatments, about personalized treatment, the importance for physicians, as I am, to listen to their patients and to come up with various therapies in order to reduce symptoms. But when we do develop an innovation, we need to be conscious about how the safety profile looks like. Is the safety profile acceptable when we perform the clinical study? And the answer for Coumadin versus 1 is yes, totally acceptable clinical profile, safety profile. If there were adverse events that were coming up during the clinical study, and you see here the graph, they were all transient and reversible and local as far as the effects are considered. When you look to the intensity, as for instance, Atralia, they were totally, similar as other products that are on the market currently. Very much important. So safety is an important thing to consider in drug development. But what patients are looking at when you apply a new treatment to them is, what about the efficacy? How does it work to me? Is my pain reducing? Is my stiffness doing better? And overall, am I performing better as a person? Those are open questions, which obviously the approved clinical study have tried to provide an answer on. So let's first talk about pain. As I said, pain is a symptom that is really hampering patients. Patients are staying at home because of pain. So very important in clinical trial setting to measure pain. How do we measure pain in clinical trial setting? We do it thanks to scales. One of the very well-known scales internationally recognized is the WOMAC scale. From a pain standpoint, you see here under the graph, we have shown at 6 months a significant reduction of more than 66% of pain score for patients included in our clinical study. What we do see is once you got the product injected in the knee, thanks to the method I just explained to you, we see a fast onset of actions. The first 2 weeks, we tend to see a reduction of pain that is being expressed by the patients. The pain reduction lasts over a period of 3 months without necessarily a flare-up effect, which you do see in other clinical study, and a lasting effect on the pain over a 6-month period, statistically significant versus baseline. So the answer is yes. With this innovation and with this treatment being used in osteoarthritis patients, we do tend to reduce significantly the pain. Question then is, what about stiffness? Is it only decreasing pain, or is it pain and stiffness? Questions comes to on the next slide, which you can see here. We do see the same impact on stiffness reduction score, a 62% reduction, statistically significant at 6 months, which is same trends explained just a minute ago for the pain score. Fast onset of actions within the 2 weeks, we see the stiffness reduction appearing, lasting effect over 3 months, and it lasts over a period of 6 months. So yes, thanks to the innovation, we are reducing pain, but we're also reducing stiffness. So not a surprise then to see that the overall functioning of patients, because behind all these dots, of course, you have patients from the clinical trials, patients are performing better, physically speaking. And that's what the key differentiator is about. That's exactly what you want to achieve as a physician and what you want to provide to your patients, functioning better after a therapeutic intervention. A 62% reduction, fast onset, maintained over 3 months period, and lasting over a 6-month period. So very much consistent with what we have seen in the previous subscore. Total score, which is a consolidation of the other ones, which is not a surprise. It's just reflecting the fact that the total WOMAC score is reduced fastly and long-lasting in a single-shot injection of Coumadin versus 1. So yes, clearly, it is a safe and acceptable product. We've seen this in the adverse event tables, but it's also much more than important, an effective therapy to provide to our patients. We didn't stop there really at QIAMed because we really wanted to figure out about responder rates and how the patients are responding to our treatments. And The way we looked at this, as far as clinical development is concerned at QIAMED, we took the highest standards, which are defined by the OAFI organization, the International Society of Osteoarthritis Research, and the OMERACT organization. They are the ones who have defined responders rates to apply in clinical studies. What we have seen in the approved clinical study in our patient set is a 76.5% responders rates, which is quite amazing at the 6 months. Average in the literature, we find anything between the 50 and the 60% responders rate. Here, we're really helping the patients. So the intervention that the physician decide to take is impacting the quality of life of patients moving forward. Satisfaction rates, of course, very important, because what we want to do as far as physicians that we are now concerned, we want to have highest patient satisfaction when you decide to apply a treatment. We do see too many patients out there in clinics taking NSAIDs, paracetamol, or other treatments, painkillers, which are not really working. So we want them to get satisfied when we bring a new innovation on the market. And here you see very high satisfaction rate, 86% average as far as patients are considered, and a 90% satisfaction rate when it comes to physicians. So all in, and that's what stays center at QIAMED, really bringing the patient into the clinical research and making sure that whatever innovation we will be continuing to develop, we are impacting their quality of life. Thank you very much, Dr. Verger. So far, this was the presentation about the data we got.
Okay, Dr. Matthews, Schiffers, thank you very much. I really appreciate your clear explanation. It's a very interesting product. Mm-hmm. And I have some questions, no?
Sure.
But, what kind of the patients should be, in your opinion, the best patients? Because we are saying that to treat in the joints, no? In your experience, for example, in our Congress today, we are, working a lot in, you can say, in patients, young patients, or maybe sports persons that they have chondropathies. Do you think that it's good to use it in more young people or not, in elderly people, or what do you think?
Yeah, it's a good question, Dr. Verges, and thank you for that one. I think a couple of things to mention when it comes to is Coumadin versus one suitable for all patients. First of all, we should have in mind that our indication is symptomatic treatment of knee osteoarthritis. And as you know, knee osteoarthritis is something that you can find with aging population, but it's also something you can find with very young patients. Repeated medical stress in young patients can lead towards osteoarthritis. And we didn't say that osteoarthritis, it means symptoms. It means pain, it means stiffness, it means less functioning. So that's the way we look at those things when it comes to patient population is concerned. While to also consider when you performing viscosupplementation, and this is true for, let's say, all single shot viscosupplementation, you have still to bear in mind contraindications. Contraindications, they are known by healthcare professionals, giving example of crystal diseases, arthritis, autoimmune diseases. There we should be really careful about viscosupplementation. And in fact, and physicians are really well placed to understand this. When you're suffering, let me take an example of severe inflammation, and when you have a knee which has been under pressure, mechanical stress, knee is inflamed, and you have those symptoms during your clinic that patients is relating to you, you need to make sure that the way you take patients on board, what you're trying to achieve is to reduce that inflammation. And that's best medical practice. What you should then considering really is then you need to check by ultracentesis if in your knee the inflammation has caused some liquid, some effusion. You need to take that effusion and liquid out of the joint pain and consider injecting an intra-articular corticosteroid. Why are you trying to do this? Well, you're doing this just to reduce inflammation in the knee, and you want to make sure that your first treatment is to reduce that inflammation. On the longer run, in a second visit, you can consider viscosupplementation with Coumadin Vis 1, for instance.
I see. Perfect. Thank you. The results that you show are very interesting, for patients because, the product, a single, injection produce a reduction of pain, improve mobility, that is very important also. And also another important issue that you mentioned is that the stiffness, That
Exactly.
is very important because the stiffness, very well, that is one of the problems that in order that the osteoarthritis process, continue to make a degradation. That means that that are very interesting in order that to stop the osteoarthritis process. What do you think about that?
It is essential when it comes to stiffness. I can take examples, and we are physician, and I'm still having practice running. We see too many patients out there who are doing some kind of therapy shopping across different kind of physician and trying to solve pain as a symptom. But in fact, you need to consider osteoarthritis as a single disease, and you need to take in consideration not only one symptom that you might diminish with oral NSAID, for instance, but you need to consider in a holistic way the patient. You need to look at pain, at stiffness, and physical rehabilitation, because that's the way you're going to impact patient performing better. And that's why innovation is so important, and that's why how we try to answer some need from a climate standpoint, but physicians do need to have different kind of therapies in hands in order to have this personalized approach to patients. And it's not only doing one injection and then you don't see the patient any longer. You need to continue to follow the patient after 1 month, after 3 months, after 6 months. You need to adapt them. You need to tend to take physiotherapy into consideration. You need to go much more into personalized treatment scheme, which works for them.
No, I think it's a very useful, product. And when do you expect to have the product in Spain? Because I'm sure that a lot of patients and sports people and doctors, they would like to know when there will be the product available in Spain. Do you have some idea, or what do you think?
Yeah, so currently the product is from a regulatory standpoint registered to the Spanish authorities. And we are currently working to find at a local place, Spanish market, a local distributor as well.
Okay, perfect. That means that will be soon.
It will, yeah.
Well, I think it's fantastic, because as mentioned at the beginning of the talk, is that we need treatments. We need treatments in the field of knee OA, and also one thing that you mentioned that for us is very important, especially because OAFI will represent patients, is the safety. It have a very good safety profile, the product, no?
Absolutely. You're right to mention about the safety profile, Dr. Verges. And I think one of the initiatives we'll be working on at European level, as far as Chiomet is concerned, we've been gathering continuously feedback from patients and physicians who have been already using Chiomedin in injection. And in fact, from this real life experience, which are colleagues, rheumatologists, orthopedic surgeons, sport medicines, rehab physicians, the fact that we are collecting this data back tells us that clearly the safety profile that have been demonstrated in the clinical trial setting has been confirmed in real life exposure. And that is essential. It's about safe product being used in the right manner and to be performant to patients suffering from osteoarthritis.
Okay. Well, I think, I appreciate your explanation. We are happy that Chiomet could participate in our symposium. Thank you very much. The product seems very interesting. I think could be a useful tool in our patients, no? Because you show very well in the clinical trial is that reduce pain, improve mobility, can stop the osteoarthritis process, is a safety product. I think this is a very important issue for our people that suffer from chondropathies, if there are young people or are more elderly people, no? That's really appreciate, and I appreciate your conference, very elegant, and thank you very much to be with us. We really appreciate. I can say something in Spanish, saying that el producto que nos ha mostrado el doctor Matías Schiffers es un producto muy interesante. Es un producto innovador, se utiliza en artrosis de rodilla, reduce el dolor de forma considerable, mejora la capacidad funcional parece ser que puede tener una respuesta también en la inflamación. Yo creo que es muy importante para evitar que esa rodilla vaya a peor y cabe en una prótesis. Yo creo que es un dato muy interesante. El producto es seguro y bueno, a ver cuándo lo podemos tener pronto en España y que nuestros clínicos lo puedan utilizar con nuestros pacientes, ¿no? Entonces yo simplemente, como comentaba al principio de mi intervención, dentro del congreso que estamos organizando con el Comité Olímpico Español, Ricardo, y con Atlético de Madrid y Servicios Médicos, pues realmente la parte terapéutica nos importa mucho, y la prevención también, ¿no? Lo que hemos estado hablando estos días, pero sobre todo la parte terapéutica es fundamental porque tenemos un arsenal terapéutico, por desgracia, muy limitado, ¿no? Y nada, yo pienso que ya, en fin, hemos hablado bien, es un dato muy interesante, ¿no?
Terminamos la jornada.
Terminamos la jornada, con broche de oro.
Gracias al doctor Scheffler. Thank you very much.
Thank you very much.
Thank you very much. Y bueno, esperar que efectivamente pronto productos como estos, porque ante la escasez y cuando encima hay problemas, pues tengamos mejores tratamientos que mejoren, valga la redundancia, la calidad de vida de nuestros amigos. Fin al primer día del primer simposium, organizado por OAFI, por el Comité Olímpico Español, por la Fundación del Club Atlético de Madrid y con todos ustedes, ya saben, el teléfono, pueden asociarse, estar y participar en los diferentes estudios clínicos que tenemos en marcha, el Gaudí, el Cavipa, el Triangle, y no se olviden que mañana, sobre las 6 de la tarde, canal YouTube de OAFI. Ahí estaremos con todos ustedes. Gracias, presidente. Gracias, doctor Berger.
Gracias, Ricardo.
Gracias a todos. Cuídense mucho. Sean felices. Buenas noches.